says, "Get out of here, you're wasting my time."
Yeah, right. It's kind of the positive insult, if there's such a thing, right? And so, yeah, I don't, yeah. All right, no, I totally believe it. And that, but he's just trying to drill into into your head, that the fact that you're very strong, and that's a great thing, and that's good. Do that stress test. If you have an uncertain family history and the reasons don't add up, don't just sit there and say, "Oh, nobody's ever said anything before, they should add up." So what? Who cares if your insurance likes it or doesn't like it? As of a certain age, you should have an EKG that is read and cleared and understood. If you have a history of heart disease, you should have an echo of some sort, depending on your history. That's a reasonable thing. It's also very reasonable to get a cardiac stress test, exercise stress. And then you know what you can control and not. Yes, of course, everyone has heard of the person that is like me. And all of a sudden you read in the paper that they were riding their bike or climbing a mountain or skiing a hill and they had a massive sudden heart attack. That's very scary to us. Usually there is some hidden factor that we didn't know. The very narrow, congenitally small or narrow coronary vessels. Coronary vessels feed the heart itself. You can be really fit, but those can be unusually small for a very strong person. And that's that relative heart attack we talked about. You don't quite get everything to the heart you need. Sometimes you can be very fit, but you have a just high blood pressure. The way your neuroendocrine system works, the hormones in your body and the way your vessels respond make you hypertensive, and you didn't know it. And that's more often the case. Or you had profound hereditary high cholesterol. And so your vessels were irritated and inflamed, and they got calcified or got plaques, and then they broke off, and you had a heart attack or a stroke. A stroke is basically a heart attack to the brain, right? So they're very much kindred spirits, the stroke and the heart attack. And you have to try to determine that. Go ahead.
You mentioned we should get a stress test at a certain age.
Right, and this is the thing that's tricky, because there are guidelines, there are recommendations that the American Heart Association has laid out for you, and a lot of those are stratified, listed and prioritized based on your family risk. So I don't have your family history. I want you to ask the question of your doctor, and they may give you the right one, maybe not, I don't know. The reasonable question is, I heard echoes can tell you a lot. Well, you don't just do an echo for any reason. Usually it's for a symptom. But if you have a family history that's significant, or you are on medication and you've never had one, you just judge how your heart is doing. I, like you, was diagnosed with a heart murmur when I was a little kid, and they didn't clear me. It was a little bit significant. And, everybody's walking around acting like I was going to keel over when I was a little kid. I didn't really understand it, but it was likely physiologic. So I had an echo. I did it when I had my friend do it when I was in medical school. I wanted to be cleared. Well, it ended up being fine, right? So that was somebody listening to my heart, not really knowing, and I'm okay. But I still did it. So stress tests are probably more rational. If you've never had one and you're over 50, that would be my goal. Do a stress test. Get on it and run, and make sure you don't have changes that show electrically. Your doctor knows that. And, and there's different types of stress tests. We do them on people that can't walk and run, that are very sick, and we do it with chemicals. It's called a chemical stress test. You can give it a little injection that makes your heart do things, and then we read it. So two things are true. I don't want people over-medicated. I don't want you to go out there and say, well, I have a medicine that's going to work for everything. But I also don't want people under-medicated. So if you're on heart medicines, this goes to my next concept of medicine errors. If you feel worse on your heart medicine, number one thing the cardiac doctor is going to say to anyone, because they blow people off, because they want you to be disease-ridden, because if you're exercising, you're living okay, your heart works okay. That's kind of true. How do you live your life? Do you feel okay? In most cases, you're okay. And that's, of course, if you're on medicines. That's easy. How you feel. Your vital signs when you get kicked out is, what did the doctor do to me today? Nothing. But sometimes they don't know if you don't tell them that you feel worse with your heart medicine. Your heart rate could be too slow. When they're treating a high one, maybe it went too low and you're not pumping enough. You have to tell them if your swelling's not better. You have to tell them if you feel dizzy, if you've passed out, if you feel like you're going to pass out when you're having a restroom break or in the shower or postural change. If you have those things, maybe that's something that's an acceptable side effect. But I would talk to your doctor about it. Do not stop your medicine because you think it's bad for you. Sudden stopping of cardiac medications can be life-threatening. So can taking the wrong thing. So it can be misdiagnosed and taking the wrong medicine. That's why you go to your doctor. But profoundly, the greatest risk is you playing a doctor with the medication that you don't understand. I want you to understand the medications you're on. If you're on 3 cardiac meds, you have to have the general concept of why you're on those 3. Well, this one's a water pill. Well, this one's a rate pill, controls my rate. This one is a pill that lowers my blood pressure by increasing the diameter of those tubes out of the heart to lower pressure. Those all tell you things. If you think about it physiologically, you'll see where those symptoms show which med's tolerated and which one's not. And over time, you'll get to know yourself and you'll get to know that medicine. Check it out, do your family history, take meds as prescribed, exercise, and if you feel bad, and it's very silly, go get checked out. And we don't, because we're so resilient and we're so compensated that we live with disease and we don't even know we have it, because our body compensates. And once we decompensate, the disease is already set and we've changed our structure, increasing the thickness of a muscle or a vessel, for example. So cholesterol meds, did you have a question? Oh, you just had an itch. Okay, all right. All right, so the fake question, all right? Now, yes, you have one.
I have a question. What about circulation? Is that all part of the pumping system?
It is.
And how can you get that checked out to see if everything is circulating?
Right, good question. Those are the tubes, vessels, arteries, veins that I talked about a little bit when I talked about the pump, what's coming in and what's going out. What's going to the heart are veins, right? Arteries have a thick wall to them and they leave the heart. Arteries have a pulse. They actually squeeze the blood where they need to go because they're full of that nutrient oxygen source that needs to be circulated through the body. Then there's the return path back to the heart to be pumped out again. That return path are veins, and there's some differences between right and left side, lung circulation, body. We won't get into that. But in general, this is the facts. Arteries go away, arteries away, and veins go to. So there are ways to check that. Doctors check pulses. They make sure you don't have too much swelling, which can be veins not bringing all the blood back, right? And that's a big deal. And you get it checked out. Now, our veins get a little saggy when we get older, so sometimes at the end of the day, you're a little swollen. But that doesn't mean your heart's necessarily weak, but it could mean that you're a little deconditioned. Because another thing that helps veins squeeze blood back to your heart is muscle. Because it runs through muscle. They talk about on planes pumping your calves, so you don't get those DVTs, those clots. Pump your calves. Those muscles help squeeze the blood back out. Our legs swell when we stand in line at Disneyland, right? When we stand at some social. We're not moving generally. We can be. So we check circulation by function most often. Do you have cold, swollen, boggy extremities? Are they blue? Are they red? Those are important things. That tells you what you're out here a little bit more. Talk to your doctor and he'll check you.